Hello, cardiac technologists. Today in this echo we share a case of severe tricuspid regurgitation and severe pulmonary hypertension, and also a severely enlarged coronary sinus, which sometimes may be a result of left superior vena cava SVC or left hepatic vein drainage. In this case, clinical correlation was suggested. Results showed not only severe tricuspid regurgitation, but also moderate to severe pulmonic regurgitation. Here are details. Left ventricle. Normal left ventricular size, normal left ventricular wall thickness, normal left ventricular systolic function. No regional wall motion abnormalities identified. Estimated ejection fraction 65 to 70%. Diastolic function difficult to evaluate due to underlying atrial fibrillation. Elevated left atrial pressure. Right ventricle. Moderate severe right ventricular dilation. Normal right ventricular systolic function. Left atrium. Severe left atrial dilation. Interatrial septum appears grossly intact, with no evidence of interatrial shunt by color Doppler. Severely enlarged coronary sinus, diameter of 3.0 to 4.0 centimeter. Right atrium, severe right atrial dilation. Mitral valve. Mildly thickened mitral valve. Mitral valve prolapse presents involving the anterior leaflet. No mitral stenosis. Mild to moderate eccentric multiple mitral regurgitation. Tricuspid valve. No tricuspid stenosis. Severe tricuspid regurgitation, multiple. Regurgitation volume of more than 80 milliliters. Pulmonary arterial systolic pressure is estimated to be 59 millimeter of mercury, with a right atrial pressure of 8 millimeter of mercury. Severely elevated right ventricular systolic pressure. Aortic valve. Trileaflet aortic valve with normal opening. No aortic stenosis, moderate aortic regurgitation. Pulmonic valve. No pulmonic stenosis, moderate to severe pulmonic regurgitation. Aorta. Dimensions of the aortic root and ascending aorta are within normal limits. No pericardial effusion. Inferior vena cava IVC is not dilated, however exhibits less than 50% respiratory variation. Severe tricuspid regurgitation is a condition where the tricuspid valve in the heart does not close properly, allowing blood to flow backward into the right atrium from the right ventricle. This can lead to various symptoms and complications, including heart failure. Primary causes: congenital abnormalities, rheumatic heart disease, infective endocarditis, trauma. Secondary causes: pulmonary hypertension, left-sided heart failure, right ventricular dilation or dysfunction. Symptoms: fatigue and weakness, swelling in the abdomen, legs or veins in the neck, shortness of breath, palpitations, pulsing in the neck. Diagnosis: echocardiography is the primary tool for diagnosing and assessing the severity of tricuspid regurgitation. Findings on echo may include enlarged right atrium and right ventricle, dilated inferior vena cava, backflow of blood observed on Doppler imaging, abnormal tricuspid valve morphology. Management of these cases are done either by medical therapy, surgical or lifestyle changes. Medical therapy, diuretics to reduce fluid buildup, medications to manage heart failure and pulmonary hypertension. Surgical intervention, tricuspid valve repair or replacement in severe cases, or when symptomatic despite medical therapy. Lifestyle modifications, low sodium diet, regular monitoring and management of underlying conditions. Prognosis. The prognosis depends on the underlying cause, the severity of regurgitation, and how well the condition is managed. Early detection and treatment can significantly improve outcomes. Conclusions of this echo. Estimated ejection fraction 65 to 70%. Diastolic function difficult to evaluate due to underlying atrial fibrillation. Normal left ventricular systolic function. Severe left atrial dilation. Interatrial septum appears grossly intact with no evidence of interatrial shunt by color Doppler. Severely enlarged coronary sinus, diameter of 3.0 to 4.0 centimeter, which may be result of left SVC or left hepatic vein drainage. Clinical correlation was suggested. Moderate to severe right ventricular dilation. Normal right ventricular systolic function. Severe right atrial dilation? Dimensions of the aortic root and ascending aorta are within normal limits. Moderate aortic regurgitation. Mitral valve prolapse presents involving the anterior leaflet. Mild to moderate eccentric mitral regurgitation, multiple. Severe tricuspid regurgitation, multiple. Pulmonary arterial systolic pressure is estimated to be 59 mm of mercury with a right atrial pressure of 8 mm of mercury. If you enjoyed this study, don't forget to like, subscribe and share. Thank you for watching.